Yeah, we met a couple times to discuss, the outbreak. The shepherds have been concerned about the coronavirus disease, the COVID-19 outbreak. As you have seen on Realm and emails, we have taken measures to mitigate our risk as a church. We want you to know that we are doing this out of love and concern for you. We have asked Jed to present the medical science regarding this deadly virus and impact on the world and our local community. At the end of Jed's presentation, we will have a question-answer session with Jed, and the Shepherds ministers will also be up here. Following that discussion, Steve will have some closing remarks and a prayer. Jed?
Oh, okay, great, thanks. Thank you. Before I begin, I'm going to say a brief statement in Spanish. No puedo traducir todo eso en español, pero al final, si tiene preguntas en español, yo puedo tratar de contestarlos lo mejor posible. All right, I was just saying that I'm not going to try and translate this whole thing in Spanish, but if at the end someone who speaks Spanish primarily or doesn't understand or doesn't speak English well enough to understand what I'm saying, I'm happy to take any questions in Spanish and try and answer them either up here or personally with a 6-foot barrier. I guess another thought I had was if there's anybody at home that had a question, I suppose they could send it in on Realm, and maybe it could be someone could let me know what it is, and we could try and answer it. So when I met with the elders and the ministers earlier in the week and strongly suggested, based on what I had seen building in our medical community and in the news, recommended that we severely pare back our group meetings. At that time, it seemed like just going to one service was pretty drastic, and I know it weighed heavily on the elders' heart because I could see it in their faces and hear it on their voices, and we anticipated at that time that there'd be the same sort of hesitation and concern from the membership why we would not meet because of something like this. We figured there might be some anger, there might be people who just don't understand, somebody might want to yell at us or make us explain it all, which was the idea behind doing this. We wanted everybody to understand why this was serious. Since then, things have evolved quite a bit. I mean, everything's been canceled. I mean, most people who can work at home are going to be working at home. There's not a sporting event, youth or semi-pro or professional going on. And the news outlets and social media have been flooded with information, mostly good, but certainly some misinformation. So I imagine that most people are fairly up to speed and understand the severity of what's going on, but we still want everybody to understand as best as possible. And if at the end of this you still have questions or concerns or think this is silly, please speak up and ask the questions, and let's work it out and figure it out so that we all go away from here, unified in our understanding of why this is important. Okay, I'll go to the notes now. So by now you've heard this term, COVID-19. You may or may not know what that stands for. It stands for COVID virus disease 2019 because the disease first showed up in China in 2019. As you probably know, because before you knew it as COVID-19, you knew it as the coronavirus. So what is a coronavirus? Well, COVID-19 is what before we called it COVID-19, we were referring to it as a novel coronavirus. That means it's a brand new virus. Sometime last year, in the summer or the fall, it's presumed that this virus jumped from a bat to a person and then started infected that person and then exploded throughout China and now across the world into our shores. Viruses, I heard someone talking about it yesterday, don't like to kill their host. They like to live in a host that can support them, where they can continue to live. Lots of animals host viruses. Bats are one of the animals that hosted this coronavirus. The reason you're hearing that these things come out of places like China is because in China, one, they've got a lot of people living in close quarters. Most of the meat they eat is actually just wild game. And by wild game, I don't mean deer or pigs that we're used to. We're talking about bats and other exotic animals, rats, things that we wouldn't touch. They have live in these marketplaces, and somebody comes along and buys it, and they'll slaughter it right there in front of them. Well, this is just a setup for something like this happening. So that's where this new coronavirus came from, the novel coronavirus. And we'll talk more about why that's important a little bit later. Now, you may have also heard that the coronavirus causes the common cold. This is true too. That's the common coronavirus. About a third of our common colds are caused by a coronavirus. But this is a coronavirus that's much milder, causes much milder symptoms. Certainly, older, frail, sickly people can die from the common cold, but it's pretty rare. We all get colds once or twice or more a year, and it's more of an annoyance. That's because we have some immunity to that. We already have some immunity, so our bodies already are fighting it off. A lot of the times, the way it makes us feel bad is our body just fighting it. There are other notable coronaviruses you may have heard of. Do you remember SARS? That stands for the Severe Acute Respiratory Syndrome. That was also a novel virus that popped up several years ago. There's MERS, the Middle East Respiratory Syndrome, very similar to SARS. That one actually jumped from camels to people. A couple of notable differences about those diseases, why they haven't spread like COVID-19 is, and I'll talk more about this in a minute, but when you can be infected with COVID-19, with the novel coronavirus, and not be sick. And while you're not sick, you're infected, and actually earlier in the course of your disease, you're the most infectious. So you can feel great for several days before you actually feel bad. During that time, you can be infecting the people you encounter. The other diseases, SARS and MERS, they actually don't become very infectious until you're already sick, so it's easy to identify who's infectious and isolate them. SARS and MERS are much more deadly than the novel coronavirus, but because we can identify those people and we can isolate them, we can snuff it out. Much different than what we're dealing with COVID-19. So, how is it transmitted? Well, it's not completely understood, but it's transmitted similarly to the seasonal flu. It's transmitted person to person by respiratory droplets. If you cough, if you sneeze, if you just talk, you can spray coronavirus into the air, and if somebody's close enough to you, usually within that 6 feet window, they can breathe it in, it gets on their mucous membranes, and they can become infected. And neither person has to feel bad when that happens. Infection can also occur if a person touches an infected surface and then touches their face or their eyes. That's why it's important to keep surfaces clean. Your usual disinfectants will kill it, and to wash your hands. You know, if you don't have, what do you call it? The Perel, whatever yeah. If you don't have that, hand soap works just fine. But just frequently washing your hands, trying not to touch your face. But once again, the biggest risk is just breathing the air somebody else is breathing. And if you can stay 6 feet away from somebody, you're less likely to be infected by that person. And certainly avoiding large crowds, because then, you know, it's just multiplied exponentially your risk. All right, what about the incubation period? Well, I mentioned before that from the time you get infected to the time you become sick is longer than a lot of other diseases. We don't know for sure, average 2 to 14 days. The 14 days is why you see people who get exposed, why they're being quarantined for that period of time, because if you can get sick 14 days after you were infected, you could spend 2 weeks infecting other people. So if you've had a known exposure, real known exposure, then you should quarantine yourself. You should stay away from other people as much as possible for 14 days. But most people get sick sooner than that. 4 to 5 days is probably the median, but it can be as early as 2 days. All right, what are the clinical features of COVID-19? Well, first of all, there's a whole spectrum of illness severity. Most infections, indeed, 80% of people will have an infection that's not very severe, although some patients will have very severe disease and some will die of it. Before I forget, one thing I wanted to mention today is, at this point, you probably don't know anybody who's infected with it, or you don't know of anybody who's been confirmed. You probably know somebody who's infected. You may be infected yourself. There are people who are sick who can't find out if they're infected because the testing just isn't quite there yet, although that's coming in line and will be more available in the coming days to weeks. But the odds are you're going to know somebody who gets sick with this. It's probably greater than 50% chance that during this wave of the disease, you're going to get infected with it. Hopefully, most of you will have mild disease. But you're going to know somebody who gets very sick from this. And the likelihood is you're going to know somebody who dies of this. There's a very good chance someone among our membership will get sick and die from this disease. And we're doing our best to try and mitigate that risk. So, like I said, about 81%, and a lot of these numbers are fluid and will change over time as we have more data, but based on the data that we have coming out of China, most people have mild or no symptoms, maybe no symptoms at all, or maybe a mild pneumonia. That's about 81% of people who are infected. 14% will have severe disease, and by that I mean difficulty breathing, low oxygen levels, or abnormal chest x-rays or CAT scans that show what looks like a pneumonia. About 5% of people who get infected will have critical disease, and by that I mean respiratory failure requiring high levels of oxygen or maybe requiring being put on mechanical ventilation. Most of the people who are sick in the hospital are just having the lung problems, but some people will have low blood pressure. There's even evidence that as people recover from the lung disease and they're in the hospital and they're getting better and they're encouraged and their families are encouraged, people are having sudden cardiac death because it appears that the virus is then affecting the heart, causing the heart muscle to become inflamed and to give out. So some people are actually having to be put on ECMO machines, which are machines that pump and circulate and oxygenate the blood outside the body, just like a machine you'd go on when you have heart bypass surgery. And then the overall fatality rate, at least initially coming out of China, was about 2.3%. There weren't really any deaths reported in people who didn't have critical illness. So if you're in the 80% that has mild disease, it's unlikely that you're going to die from it. Age. Well, any age can be infected and be affected by it, but adults of middle age and older than that are the most commonly affected. The older the age, the increased risk of mortality. Out of China, if those in the age range of 70 to 79 who were infected had about an 8% mortality. If you were 80 years or older, it was a 15% mortality. And you can think as you go older, it's just going to get higher. Symptomatic infection in children is actually pretty common. Kids get infected, are infectious, but most of them don't even know they're sick or may never even feel sick, or if they do, it's going to be pretty mild disease. So who are the high-risk population for severe fatal disease? If you've been reading anything online, watching the news, reading any of our posts on Realm, you've heard this list before. I'm not really clear about infants. I haven't heard a whole lot about infant disease just yet, but I would take all precautions with infants because their immune system is not fully formed, and so I wouldn't take any chances with infants. Pregnant women are at higher risk. They also are immunosuppressed during their pregnancy. Diabetics, very high risk. Even high blood pressure, even if it's controlled, is a risk factor for having severe critical disease. Anybody with chronic heart or lung disease, like we said, the lung is the most likely organ to be affected, and then we've seen some damage to the heart as well. If you have any type of chronic lung disease, if you have a long history of smoking, if you still smoke, if you have COPD, if you have asthma, any other interstitial or chronic lung disease, take every precaution possible. Same with any kind of heart disease. And then, of course, anybody who's immunosuppressed. Some people have diseases that cause their immune system to be suppressed. Some people have diseases that are treated with immune suppression, autoimmune diseases, people being treated for cancers and blood diseases can be on immune suppressing diseases, medications. So if people who've had organ transplantation are at high risk, so those people should take every precaution, and those who are around them and know them should take every precaution as well. So what are the symptoms? Well, 99% of people are going to have fever. 70% of people are going to feel fatigued and run down. 59% are going to have a dry cough. 40% may lose their appetite. 35% are going to have myalgias or body aches. This is pretty common to the influenza. We've ever had the bone and body aches of flu. Some people are going to have that. Some people are going to feel short of breath, about 31%, and about 27% will produce some sort of sputum. Like I said before, pneumonia appears to be the most frequent serious manifestation of infection, and once again, pneumonia would be characterized by fever, cough, difficulty breathing, and if you go to the emergency room or the hospital, they may see evidence of pneumonia on a chest x-ray or a CT scan. So what about making a diagnosis and testing? Well, the test, if you have one, is going to be a nasal swab. They're going to run a swab through the back of your nose to the back of your throat, and they're going to send it to the lab to test. At the moment, testing is limited. We kind of got a late start on that, but they're working hard to get those tests up and running and available to the public. Like I said before, there are already some drive-through places where you can be screened and test. Now, at the moment, because they have limited tests, if you show up and you fill out their paperwork and they think you are low risk, they're probably not going to test you. They're probably going to send you home and say, we can't test you. We've got to save that for people who are higher risk, people that we really need to know with more certainty that they don't have the disease. So don't be shocked if you show up and you don't have you haven't been exposed to anybody who knows it, very mild disease, they may send you away. As we have more test kits available, they may start just testing anybody who wants it. But at the moment, it's somewhat limited. How about management? How should we treat the disease? Now, Paul, I'm going to disagree with you just a little bit. Everybody who gets sick from this should not go to their doctor. You can call your doctor, but the last thing we need are people who are infectious showing up at the doctor's office. I promise you, if you go to your doctor's office here, probably starting this week, I know if you go to the hospital where I work, you're not going to get entrance to the hospital unless they've screened you. You're not going to get entrance to the doctor's office unless they've screened you. If they think there's a high chance you've got it, they're not going to let you in. If you feel bad and you think you're sick and you're otherwise healthy, if you've got fever, if you feel run down, fatigued, mild upper respiratory symptoms, stay home, take the usual medications, and stay hydrated, do the usual things you would do. If that's not getting better, certainly call your doctor's office and get their advice. They may tell you, go to the emergency room, or they may say, go get tested if that's available. Or they may say, just stick it out at home and you'll get through this. Like I said, 80% of people are going to have mild disease that's not going to cause them any harm. But certainly if you start having shortness of breath, worsening cough, sputum production, it's not getting better, call your doctor. You're probably going to get sent to the emergency room. But we don't want to flood the emergency rooms and the doctor's offices with people we can't do anything about and put other people and the physicians and nurses working there at risk. One of the things we're trying to protect are limited resources. We'll talk more about this, but we need to keep our healthcare providers healthy and working. We need to make sure our ERs aren't overrun, because people are, ERs are already busy without this. Those same people who need the ER are still going to need the ER in addition to people who are infected by COVID-19. We don't want our doctors in the hospitals getting sick. We don't want our nurses getting sick. We don't want to run out of ER beds. We don't want to run out of hospital beds, ICU beds, ventilators, things like that, because then we have to start making decisions that we really don't want to make. So most disease is going to be mild. It's going to be supportive care. If you get sick in your house and you live with other people, the best thing you can do is isolate yourself to a room in the house, and people should just avoid that room. If you can have a dedicated bathroom, that would be ideal. Nobody should share a towel with you. If somebody has to come into your room or come into your presence, if at all possible, you should put a mask on. They don't need a mask. The surgical mask, the mask you saw the men wearing this morning, will not protect you. It's special masks which are not available to the public that will protect you, the others, from getting it. If you have it, the best thing you can do is wear the mask, because that prevents you from spraying that 6 feet area. You'll limit it to just right around you, but still, you want to limit your contact with other people. And if you do that, you can do a pretty good job of keeping everybody in the house from getting infected. So just more aggressive social distancing. Like I said, if you're not getting better, consult your doctor by phone. If you're not getting better and developing worsening symptoms, like I said, hard time breathing, bad cough, you might need to go to the emergency room. Prevention, you've heard a lot about this. Hand washing, avoiding touching your face, clean surfaces frequently. Once again, routine kitchen household cleaners will kill it. My daughter got a kick out of showing me the back of the Lysol can that said all the things that it kills, and coronavirus is on there. Because as we spoke about, coronavirus, the common coronavirus has been around and causes the common cold. So it wasn't just a prescient thing by Lysol to put that on the back. And then once again, social distancing. So why is social distancing so important? Okay, we've talked about this. You understand the 6-foot rule. You understand how it spread. Why is it important that this is a novel and a new virus? This is the key to everything right here. Nobody, before this virus jumped from a bat to a human in China, however many 6 to 9 months ago, nobody had any immunity to it. No defense against it. And the only way we're going to get immunity right now, there's only 2 ways to get immunity. One is to have a vaccine. We're not going to have that for a year or 2. So we're going to have to deal with this more aggressively than we would the flu, because we don't have a vaccine. And right now, most people have no immunity to it. The only way we're going to get any immunity in our society is for people to get sick and get well and walk around with antibodies in their body that will recognize it and kill it before it causes infection. When You remember back in probably junior high and high school and maybe even your college American history classes about what was when explorers and settlers came to the Americas for the first time and they met the Native Americans. What was it that killed off so many of them right off the bat? It wasn't that we hunted them down and killed them all. We did that later. But what was it that killed them? What was it that killed a lot of them for a long time? Disease. Yeah, I mean, just diseases brought from Europe that Europeans had some immunity to because they've been passing it around for decades, hundreds of years. The Native Americans had no immunity to these diseases, and it ravaged them. It killed them in droves. And that's exactly what's happening on the earth today. That's why this thing is caught like wildfire, because nobody had any immunity, and in China, they either didn't recognize it or didn't admit it quick enough, didn't take measures quickly enough, and it caused an endemic there, now a pandemic. The same thing happened in Italy and is happening in Spain and France. Italy didn't take this seriously. The posts I've seen on social media coming out of Italy, people who are now basically by law required to stay in their homes unless they're going to the pharmacy or the grocery store or certain critical jobs, they're saying, don't do what we did. We said, oh, this is like the flu, this is like the cold, it's no big deal. And then it's killed record numbers of people, it's overwhelmed their hospitals, they don't have enough ventilators to keep people alive. They're deciding who lives and who dies based on who's most likely to benefit from the treatment. That's what we're trying to avoid here. And if we don't get this under control, if we don't learn the lessons from China and Italy and parts of Europe, and even in our own country, in Seattle, in Seattle, because we didn't have testing and we didn't realize it was there, it was floating around Seattle for several weeks before it exploded. They're having the same problem in the hospitals and the ICU in Seattle right now that they're having in Europe. We're not hearing as much about it because I think they're trying not to instill panic, but those of us in the medical community, we're hearing about it through social media and the different grapevines. But that's what we're trying to avoid because we have no natural defense against this disease as of yet. So like I said, no vaccine for a year or two. So the other thing to keep in mind is this is not going to be a week or two. Kids aren't going back to school in a week or two. That was just a stopgap so they could reevaluate and see where we are. But all the experts will tell you that this is going to be a months-long problem. Are we going to be out of the woods in 3 months, 6 months? Hopefully. Some people are hopeful that warmer weather will make a difference. The experts I've listened to aren't hopeful about that because the MERS coronavirus that we talked about earlier is a year-round problem in the Middle East where it's 110 degrees. So if it turns out that the summer knocks this thing down, maybe because we're outside more, although in Dallas we're inside just as much in the summer as we are in the winter, there's no reason to believe that summer is going to mitigate much. If it does, we'll be ecstatic about that. But that's what it's going to be to get through this first wave, probably 3 to 6 months, to kind of get it to die down. And hopefully we don't overwhelm our medical system in the meantime. It's probably going to come back. And like I said, we're not going to have a vaccine for maybe 2 years. That means we're going to have to continue to protect our high-risk population from getting sick because there's no vaccine to protect them. They're still not going to have any immunity. Now, it's not going to spread like wildfire like it did the first time because there's going to be people who are immune. So, if half the people in this room are immune and we get exposed, well, there's a little bit of extra barrier. I can't, the growth of it won't be exponential, which is part of the problem, and we're about to talk about that. All right, so why is this thing spreading like wildfire? Well, the answer is because it's spreading exponentially. So let's go to the next slide. All right, I'm going to I shared this with the elders. I put it on social media. Maybe you've heard this, but there's this riddle or parable, I'm not sure what you would call it, about the lily pond. So imagine a pond that has one lily pad in it. And that lily pad replicates once every day. So on day 1, you have 1 lily pad. On day 2, you have 2 lily pads because each one of those lily pads reproduced. On day 3, you're going to have 8 lily pads. On day 4, you're going to have 16 lily pads. You remember that from high school math? 2 to the power of 2. So that's exponential growth. If on day 30, that pond is completely covered with lily pads, how many days did it take that pond to be half covered with lily pads? 29 days. 29 days. Let's look at the next slide. All right. So what this, I don't have a pointer. Does this have a, oh, awesome. Maybe not. No. Okay. So what this shows is this graph right here is what you see with something that grows exponentially. On the x-axis, you have the number of days that the lilies have been replicating in the pond, and on the y-axis, you have the percentage of the pond that is covered, with 0 at the bottom and 1 representing 100% on the top. So you can see that for 24, 25, 26, 27 days, you can hardly tell if there's any lily pads on the pond. Between day 26 and 27, you cross over from about 5% or 6% to maybe 12% of the pond covered, okay? You've probably heard, you may have said it yourself, why are we so worried about this? People have said it to me, why are we canceling services? Why are we canceling all these things when we don't even have people in our community that have it? Okay, well, we're on this flat part of the curve, but sometime in the next week or two, we're going to be on the steep part of the curve, and we're very quickly going to go from not looking like anybody's sick to looking like everybody's sick. That's why we're doing this, because we have to slow down this progression. Okay, go to the next slide. Does that make sense? Any questions about that? All right. Get the next slide. All right. This is why it's so important to slow this down. I'm sure you've seen the hashtag, flatten the curve. That's what this is what this is talking about. So over here, I'll stand on this side this time. Still on the x-axis, you have the time since the first case, say in our community, okay? And on the y-axis, it's the number of cases. And that blue dotted line is basically how many hospital, ICU, ventilators, basically our hospital capacity to take care of people who are sick. Once we have more cases than that line at any one given time, we now have to decide who lives and who dies, who gets life-saving treatment and who gets sent home on hospice, who gets a ventilator and who gets morphine, okay? We want to stay below that line. The red is what happens if we don't do all this social distancing, if we don't cancel church services, if we don't cancel ball games, if we don't cancel school, if we don't cancel professional sports, if we don't ask people to work at home, if people continue to go to social outings. I mean, if you look in the newspaper and on social media, there's all these young people at bars in New York City. You know, they're going to shut down everything except the grocery stores and the pharmacies if people don't start following these recommendations. So far, we seem to be doing a pretty good job. But if we don't do these things, and if we don't do them well enough and take it seriously, we're going to be in that red zone above the line. Okay? We need to stay below that. Otherwise, we're just not going to be able to care for people. And if we get above that blue line, not only are people who have this disease, COVID-19, not going to survive, we're also not going to have the resources to take care of all the other people who show up at the hospital sick with something else. You may have something that normally would be admitted to the hospital, but because there's no resources, you're going to have to go home, and you're going to get inadequate care. And people are going to die because of that if we don't flatten the curve. This last Wednesday, I failed to mention, for those of you who don't know, I'm a physician. I'm a pulmonary and critical care specialist. That means I'm a lung specialist, and I take care of people in the ICU. So I take care of the sickest of the sick. I'm going to be taking care of these people in the next couple of weeks when they show up. So myself, my partners, the hospitals, I've been on conference calls all week long. I've got one today at 3 o'clock, just keeping up to date. This is a rapidly evolving issue. But one of the conference calls I was on this last week was an ethics conference call. And we went over the mass casualty guidelines that the Baylor Scott and White system has. What does that mean? Basically tells us how we're going to decide who gets life-saving therapy and who gets to go home on hospice if we pass that threshold. So we have, that was actually formed as a result of the SARS scare a few years ago, but it was never there was never any chance that was going to happen. But there's a real chance it could happen now. It's happening in other parts of the world. It's probably happening in Seattle. We don't want it to happen here or anywhere else in the country. So that's why all of these draconian measures are so important and why we really have to take care. Now, do we know 100% everything's going to happen just like we said? Is that exponential curve going to follow like that? Well, that's what's happened in other parts of the country. Is it going to be as bad here? I hope not. But there's no reason to think that we're not at risk for that and that these things aren't important. And if this thing dies down in a month and everything looks good and we get to have a normal summer, please don't get on social media and say, see, that was just a big hoax. That was just a big, that was perpetrated by the media to make us, do what they wanted to do. If we get to enjoy our summer and we get to worship here as a congregation and we get to go to ball games and our kids get to go back to school, it's because we did all this now. So that's I think the most important thing that I wanted to get across. I wanted everybody to understand it, but I don't want anybody making light of this, because all you have to do is make light of it to a few people who aren't now as well educated about it as you are, maybe you already were. They may think, this is no big deal, this is just the flu, this is just a cold, no big deal. I'm going to get on, I don't feel well, I'm going to go to a worship service, or I'm going to get on a plane, and I'm going to infect all these people, or I'm going to go to a public place. We can't, by our own personal actions, when we can't adversely influence somebody else to not take this seriously too. All right, that's all I have to say. I will answer any and all questions as long as it takes. Yes?
I saw about a week and a half ago, Vice President Pence with the team that's been assigned to
Mm-hmm.
they said they had just had a meeting with all the executives of the pharmaceutical
Mm-hmm.
industry, and they said within a few days, hundreds of thousands of kits would be shipped to each state, split up
Mm-hmm.
each state, so they have the testing.
Mm-hmm.
And by another week, 800,000 would be
Mm-hmm.
shipped out. Was that all garbage?
I don't know. I mean, you always have to take with a grain of salt what comes out of Washington's, any politicians, whatever their affiliation. I think it was hopeful thinking. I don't know whether it was an outright lie or it was hopeful thinking. If the projections from the drug companies, from the CDC, were that they could deliver that. I know a week ago, Baylor Scott and White said, hey, on last Monday, they said, hey, within a couple of days, we're going to have tests available. Well, they had very few tests available. We're still don't have enough tests. They're hoping to get these drive-by centers, but it's just moving slower than we anticipated. Why that is, lots of people speculate and lots of finger pointing is going on, but, I think it was probably a combination of wishful thinking and maybe a little deception too. I don't know. But they're working on them. Private companies are working on getting them. It's just going to take longer than we'd like. And I probably for a while, no matter how many tests we have, there's going to be more people wanting to be tested, which is why they're just going to have to screen people. Another thing, just so you understand, you may have read in the news where it says that we have a presumptive positive case somewhere, and that may sound kind of oxymoronic. The fact is, all of these new tests that drug companies have created haven't been validated yet. They're probably accurate, but they have to be validated with the test at the CDC. So it takes a couple of weeks. A lot of these tests get tested here locally, and we get a presumptive positive or negative. It's then sent to the CDC where they confirm that test. And once every individual test kit or group of test kits or style of test kits is validated, then you'll stop seeing that presumptive positive. What else? Any other questions? Yes, sir.
I
I've heard that too. I think a lot of this information is what's the truth, we don't know for sure, but I've heard that quite a bit too. So that's just the importance of just trying to keep surfaces that you're touching frequently clean, and wash your hands. Lynn? Oh, sorry, yeah. His question was, he heard that the virus can stay alive for 2 to 3 days on hard surfaces. And I've been hearing that too. How accurate that is, I don't know. I don't think we're certain about any of this just yet, but that's our best understanding of it. So it's important to keep the surfaces clean, wash your hands, don't touch your face, the same old, same old. Yes, sir. I don't think that's the case. I mean, you don't want to get the flu right now, so if you haven't had the flu vaccine, if you can get it, I'm not sure how available it is. We're at the end of the flu season. I'm sorry, he asked, is there any evidence that flu vaccine, having or taking the flu vaccine will decrease your risk of getting COVID-19? And the answer to that, I think, is no. It's important to have the flu vaccine because you don't want to get the flu and get COVID-19 on top of that, or end up in the hospital taking up resources at this time too because of getting the flu if it could have been prevented. Jesse?
Yeah, I heard that a lot of people are saying that you should take vitamins to build up your immune system. That's something
Yeah, so Jesse's asking about should we take vitamins to try and build up our immune system. So I'll start by saying in general, yes, we should, in addition to social distancing, washing our hands, not touching our face, all that stuff, the more we can do to boost our immune system, the better chances we're going to be able to prevent getting sick or having a mild case of the disease. Now, what can you do to boost your immune system? Well, one, get enough rest. Try and get as much sleep as you can or that you need to feel good and feel healthy. Everybody's a little bit different, but try and get plenty of rest. Exercising is important. If you exercise, keep exercising. Now, I wouldn't kill myself exercising because you can suppress your immune system by doing too much. But if you exercise or you want to start exercising, start light, get a little exercise. That boosts your immune system as well. Eating a healthy diet is very important. How much benefit are you going to get from taking vitamins? It's hard to say. Certainly probably wouldn't hurt to take, a usual dose of vitamin C or a multivitamin, but that's probably not as important as getting enough rest and just trying to eat a wholesome diet. Yes?
So I have a friend who's a pharmacist in Austin, and she's reading all sorts of articles and stuff, just like I'm sure you are. There was some article by the Department of Epidemiology and Biostatistics in China that published that at least their test, maybe it's just theirs, had 80% false positive rates. Is that something, or have they not? I know you said they're going to have to make sure that these tests are valid. Is that something that the tests they have out now are having a lot of false positives? Or?
So he's asking how reliable are the tests that we have. There was some concern that the test in China had a lot of false positives, meaning it said you were positive when you actually weren't. My understanding of most of the tests that we have here are, so when you have a screening test, there's two sort of percentages that go along with it. How sensitive is it? Meaning, what are the chances if you have the disease that it's going to test positive? And so a very sensitive test is going to catch everybody who's got the disease. Now, it might have some false positives. A test is very specific. If it gives you a positive test, it means you have the disease. My understanding, at least of the test that was going to be, that Baylor Scott and White had developed or was using, was highly sensitive and highly specific. So they felt confident that that test, and I imagine the other tests from the U.S., it'll have to be validated, but my understanding is they feel like if you test positive, there's a high chance you have it, and low risk, relatively low risk that you're going to get a false positive. Not perfect, but supposed to be highly sensitive and highly specific. while you're thinking of questions, one other thing I wanted to mention, because I've heard several people mention it to me. You've probably seen on certain news outlets and on social media where they've put up a split screen and they've compared the number of deaths, number of cases, number of deaths of COVID-19 compared to the number of deaths and number of cases of influenza since 2011. And it makes it look like the flu is way worse than COVID-19. It's kind of a disingenuous comparison because you're comparing, first of all, even if you were just comparing this year's flu season to COVID-19, this year's flu season is almost over. This whole COVID-19 thing is just getting started. But if you're just and it's only been around, COVID-19's only been around for a few months on, infecting humans on this earth. Influenza, if you're using data for several years, those numbers are going to look way skewed. Let's check back on those numbers in, a year. That's one of those things where we have to be careful not to be influenced by something like that. Any other questions? Were there any questions from Realm or anything that you saw? Anybody? No? Okay. If anybody has a question after this later at home, my number's on Realm. You can text me or call me. I'll be working this week, so I may not be able to answer my phone right away, but if you leave a message or send me a text message, I'll do my best to get back to you. All right. Thank you.
We are very fortunate as a congregation to have Jed as one of our members and to have his experience and his expertise, particularly in something that is affected so much by this particular virus. We have taken it very seriously, and we will continue to listen to him as one of our main, if not our main source of information, so that we can keep you safe, so that we can give you all the proper information, so that we can give you a forum like this where you can actually ask questions. And we would continue to ask that if you do have questions, don't hesitate to ask. I think one of the things that he pointed out that was so important is that we will get to a point at some time, maybe, where we could even overwhelm the system. And if you overwhelm the system, it forces them to make decisions they really don't want to have to make. And that would be very, very sad and very difficult. And we would hate to put them in that position knowing what we know if we can do something about it. So I would encourage you to do that.